Should a physical activity plan be rigid or flexible? For individuals with musculoskeletal pain, physical activity is often a cornerstone of effective long-term treatment. However, rigid adherence to prescribed exercise plans can be counterproductive, often leading to frustration and low self-efficacy when patients cannot comply, ultimately hindering consistent engagement. It is critical for healthcare professionals to understand and convey that physical activity plans for pain management are guides, not strict rules, and should be flexible and adaptable to a patient's fluctuating symptoms, daily circumstances, and overall energy levels. Why is flexibility important in activity planning? 1. Enhance self-efficacy and internal locus of control. Empowering patients to make autonomous decisions about their activity levels within a beneficial framework, for example by pacing, increases their self-efficacy, that is, their belief in their ability to successfully manage their pain and engage in activity. This shifts their locus of control from external factors, such as the pain itself or the doctor's strict orders, to their internal ability to adapt, which is crucial for long-term self-management. 2. Accommodation of pain variability. Chronic musculoskeletal pain is inherently dynamic, with good days and bad days. Rigid plans fail to account for this natural fluctuation, leading to patient discouragement and dropout when they cannot meet targets on symptom-heavy days. Flexible plans allow for sensible adjustments, such as reducing intensity or duration, to maintain consistency, even on challenging days, thus promoting sustained engagement rather than complete cessation. And 3. Optimization of lifestyle integration. Physical activity should be integrated into a patient's life, not viewed as a separate, burdensome chore. Flexible approaches help patients find ways to incorporate movement that fit their unique schedules, preferences, and social contexts, making it more sustainable and enjoyable. This encourages a holistic view of activity as part of overall health and well-being, rather than merely an exercise for pain. How can you promote flexibility in activity plans? 1. Educate on pain variability. Explain to patients that chronic pain naturally fluctuates and that their activity plan is designed to accommodate this. Make it clear that some days will be harder than others and that this is not a sign of failure, damage, or taking a step back in their plans. 2. Introduce pacing and graded activity concepts. Teach patients how to pace themselves, balancing activity with rest to avoid flare-ups, and how to apply graded activity, gradually increasing activity based on tolerance, not just a fixed schedule. Emphasize listening to their body's signals and adjusting, rather than pushing through or stopping completely. 3. Frame plans as guides, not rules. Talk about exercise prescriptions as flexible frameworks rather than strict, unchangeable regimens. Encourage patients to adapt duration, intensity, or even type of activity on different days. Emphasize that consistency, that is, doing something most days, is more important than rigidly hitting specific targets every single day. And 4. Empower self-monitoring and problem-solving. Encourage patients to monitor their symptoms and activity levels and to actively find ways to adapt their plan. Rather than just expecting them to report adherence, ask them questions such as, what adjustments can you make with regards to movement on days that are a bit tougher? This builds their appraisal skills. Let's put it in practice. Dr. Evans, a physical therapist, is discussing an exercise plan with Maria, who is in her 40s and has chronic low back pain. She fears flare-ups.
Maria, consistent movement is key for your back pain. This plan is a guide, not a rule book.
But last time, I pushed too hard on a bad day, flared up, and quit. I'm afraid.
That's common, and the reason why flexibility is vital. Your pain will fluctuate. If you push too hard on a tough day, you'll feel frustrated and stop. The goal is consistency, not perfection.
So, If I can't do the full amount, it's not a failure?
Absolutely not. It's smart self-management. You adapt the plan to your body that day. This flexible approach reduces fear, builds confidence, and prevents those big setbacks. You'll consistently move, even if it's modified, leading to long-term progress.
That makes more sense. So if I'm having a really bad day, a few stretches are okay?
Exactly. A few stretches, a shorter walk, whatever feels manageable. The goal is consistent engagement with movement. It is not just the dose or intensity of exercise that can be flexible, but preferences, access, and so on. So we will work with you to find a form of activity that you like, or at least don't hate. How does this flexible approach feel?
Much more doable. I think I can stick with this.
To sum up, promoting flexible physical activity plans is essential for effective chronic pain management. By emphasizing adaptation, empowering patients to pace and modify activities based on their daily variability, and framing exercise as a guide rather than a rigid rule, healthcare professionals can significantly improve patient adherence, reduce fear avoidance, and foster sustainable active self-management. This approach empowers patients to build lasting resilience and improve their quality of life.